Thank you, Mr. Chairman. Director, you hold an important role in our common goal to reduce illicit drug use. Your success is of utmost importance as our nation is experiencing what you've heard from both of us, record-breaking deaths from overdose. We know that fentanyl and its analogs are driving the surge in drug overdoses. I'm invested in making sure that fentanyl analogs are permanently scheduled, and I think you are too as well, since ONDC sent Congress draft legislation last year that places fentanyl drugs in Schedule 1. It contains other provisions like encouraging research. I could probably work with you on that part of it. Unfortunately, it also includes problematic policy choices of removing mandatory minimums for fentanyl traffickers, which doesn't have sufficient support in Congress. As you know, the authority to control these drugs expires at the end of the year. So can you give us an idea of your approach to making sure that permanent class-wide scheduling solutions happen by the end of the year?
Thank you, Mr. Chairman. We are really serious about making sure that the scheduling of fentanyl as a class is important, fentanyl-related substances. Having said that, as a class, I could tell you the physician is a unique and interesting way to schedule substances. With it brings a lot of complex factors, and that's exactly the reason the administration's proposals proposed scheduling fentanyl as a class, but also balancing that with civil rights and this research part. That proposal is in Congress's hands. We would love to continue to work with you and your office and your staff to figure out a path forward, but it is imperative that we continue to find a permanent path forward.
Why don't you give me a rough idea of what some of those things are that are a problem for just a simple thing that Congress has been doing 4 or 5 times on a piecemeal basis for 2 or more years, making it scheduled?
When we look at the entire class, Senator, what we don't know is what the future will hold. There may be inert compounds, but there may be others that may not be subject to be active compounds. We want to be careful, first of all, that those are included, but also they are cautiously included as a class. Secondly, the notion of the idea of the sentence guidelines does not apply to serious bodily injury or death investigations. And what I've seen in West Virginia, it allows more flexibility for judges to be able to judge. Now, having said that, we would love to continue to work with your office to find a path forward.
Some critics of class-wide scheduling think it could undermine research with potential benefits of fentanyl drugs, but interagency bill that you shared with Congress has both scheduling and research provisions. Can you explain how research into fentanyl drugs is still possible while permanently controlling them?
Senator, are you asking about the proposal, part of that proposal, or research separately?
Well, they are together. So since it's in the legislation, it seems to me that we can permanently schedule them and also provide for the necessary research. It seems pretty simple to me.
We believe that research could be provided. I think research, good innovation and research would help in the future to create the next naloxone, potentially, the next treatment. So I do think that research can be done on that. That's exactly why the proposal included having research as a component of the permanent scheduling.
National Drug Control Strategy is mandated by federal law. GAO did a review. It noted that ONDCP was delayed in publishing the strategy this year and that you've yet to release documents that are part of the 2022 strategy. Specifically, the missing documents are a 5-year projection of the National Drug Control Program and budget priorities, along with an outline of specific resources needed to implement the Southwest Border Strategy. Why did you fail to meet the statutory deadline for releasing the strategies, And when will ONDCP release the documents to more effectively address the drug crisis at the southwest border?
Thank you, Mr. Chairman. When I came into the office as a physician that's worked on the ground with people, my first goal was saving lives, and I wanted to get this strategy right. It's very important for the American public that we worked on saving lives and get this right. And that's exactly what I did. I went back and looked at the entire draft that was available, made changes, went through the interagency process, had 2,000 consultations with stakeholders, all 50 state governors, as well as the interagency partners. So to me, it's more important to get it right because lives are at stake. And indeed, just today, CDC has released numbers that are showing for the first time we're seeing smaller numbers increase, but also few hundred fewer deaths than the last time this report was released. So it is important. Now, on the path of the question of the other documents, we are constantly working very closely with GAO and our interagency partners. I am committed to working to release those documents as early as possible, and I will continue to work. You have my commitment to work with your staff in Congress to get those out.
You must have a timetable you want to get it done, or it'll never get done.
I will get that to you very responsibly, very quickly.
Okay. I've heard from families, parents, IONs as well, about counterfeit pills laced with fentanyl or meth. Drug networks are mass-producing fake pills, falsely advertising them, most often to young people. You know the deadly results. As a parent, grandparent, this is troubling since young people are susceptible to online marketing of these deadly pills. I recently introduced a bipartisan bill that closes loopholes and supports enhancement for spreading laced counterfeit pills. Also, DEA is leading a campaign to raise awareness on this issue, despite the seizures of laced pills skyrocketing and pills being available in every state in the country. It doesn't seem like ONDCP is tackling this issue head on. For example, when I searched the 2022 strategy, the phrase counterfeit pills came up 4 times. Compare that to the phrase harm reduction, which was mentioned 198 times. So, Mr. Director, how are you going to refocus efforts to stop the spread of deadly illicit counterfeit pills, and how can Congress do to support your effort?
Thank you, Mr. Chairman. I think the counterfeit pills is a real challenge in front of us. It is all populations that they're looking at to getting non-prescription pills, and this has become very dangerous in terms of drug supply. Especially every life loss is tragic, but especially when it's a child, it breaks our heart collectively. I think the important thing here is that along with DEA, and thank you for looking to work with DEA and us on separate pieces, we're looking to, along with the One Pill Can Kill campaign, working with social media companies to make sure they're holding themselves accountable for the distribution. We're also working with various other law enforcement agencies to make sure that we know what that e-commerce market is. Postal Services is working with e-commerce as well to look at that supply chain. And those things are happening as we speak, but we can do much more in terms of making sure that parents, school teachers, neighbors are aware the danger of these counterfeit pills because they are a true danger in our communities.
Senator Hassan.